I'd like to welcome everyone to the annual Stand Against Racism of the YWCA of Central Mass. We are joined by our sisters, our 8 other sisters in the YWCAs of Massachusetts, and our 200 plus sisters in the country, YWCA of USA. So this is the day, but for this YWCA, every day is a stand against racism. And we are so happy for you to join us today. Our awesome panelists, Dr. Selk and Dr. Castiel, will help us present that racism is a public health issue. And this isn't just for today. This is something that we have been working on for a long time, that as violence is a public health issue, racism is a public health issue. I'm supposed to do this little technological thing. If you would like to see further information on activities happening to the Stand Against Racism, please go on the YWCA website. So ywcacm.org. And as I'm told, follow us on Twitter, Facebook, and Instagram, like it, and share it with everyone, because today we join together in a stand against racism. Again, for us, it's every single day. It is my great pleasure to introduce my colleague and friend, Maritza Cruz, who is the Director of Race and Gender Equity for the YWCA Central Massachusetts. Maritza.
Good morning. Can you hear me now?
Yes.
Okay, that's become the standard for everybody. Can you hear me now? Good morning, buenos dias, buenas tardes, I should say. Good afternoon, everybody. And like our fearless leader, Linda Cavioli stated, welcome to our Stand Against Racism 2021. Thank you for all of you who are here with us today. We appreciate it, and we're grateful that you are joining us in this very important community forum that we are presenting. As you know, here at the YWCA, we live our mission every single day, which is the eliminating of racism, which we know we'll never eliminate, but we sure can damn hell dismantle it. And that's what we try to do, and the empowerment of women and girls. So this is what we do every day. And so we bring this forward. This is a signature event that happens across the country, a Stand Against Racism, and here in Worcester. It's very important, and we know that the Worcester and Central Mass community look forward to this event every year because we are fearless in presenting the realities of what racism is. So why declare racism a public health crisis? Racism has a long-standing history in our nation of the United States, a country founded on white supremacy. Racism permeates every institution: the political system, education system, the healthcare system, the criminal system, the economic system, the environmental system, to just name a few. The ongoing racist practices that plague our institutions have been afflicting multiple generations of Indigenous, Black, Latinos, and people of color since the beginning, resulting in inequitable communities that are disproportionately impacted by injury, disease, and premature death. In May 2019, Milwaukee was the first to declare a racism a public health crisis. Since then, policymakers from over 210 municipalities and 30 states, including our state of Massachusetts, have formally highlighted and stand as a public health, declare racism as a public health crisis. Municipal and state governments are going on record stating that racism needs to be treated with the same kind of urgency and resources used to tackle any other health crisis. This is a pandemic that we've been dealing with as far as racism. These kinds of declarations are an important first step because they focus on systems and structures rather than dismiss the inequalities as the fault of the individuals or the people. By naming racist foundational policies, the urgency to highlight racism as a public health threat, as we have all witnessed with the stark statistics of the COVID-19 pandemic and the ongoing police violence, are an inescapable crisis that have been killing Black, Brown, and Indigenous people at disproportionately higher rates historically. On September 4th, 2020, Representative Ayanna Pressley, Democrat from Massachusetts, introduced the Public Health Act in Congress, a bill that would formally identify systemic racism as a public health crisis in the United States. This bill, which has Representative Barbara Lee, Democrat from California, and Senator Elizabeth Warren, Democrat from Massachusetts, all women, as you notice, are also sponsors, co-sponsors, would create a national center for anti-racism within the Centers for Disease Control and Prevention to develop anti-racist federal health policies. It would also create programs within the CDC Center for Injury Prevention and Control focused on preventing violence by law enforcement. The proposed bill will cover money for research, data collection, and grants focused on anti-racist public health interventions and the health impacts of structural racism. The bill died under the former Congress. However, this past February 2021, the Anti-Racism and Public Health Act was reintroduced as a bicameral bill by all three women again. What will definitely ultimately distinguish effective efforts, real efforts, from symbolic or purely political ones will depend on where municipalities and the federal government choose to place their resources and the effort to treat racism as the public health crisis that it is. So I will now be introducing our two powerhouse women of color. We have Dr. Sabrina Selk. She is she joined the DPH as the director of the Office of Health Equity in March of 2018. Sabrina brings extensive experience developing data for communities to better understand and address social determinants of health and improve the health of families and children. Dr. Selk worked previously at the National Institute for Children's Health Quality, where she led the Department of Applied Research and Evaluation. In her role, Dr. Selk was a senior advisor on a number of projects across content areas, including asthma, sickle cell disease, infant mortality, and early childhood comprehensive systems. Dr. Selk also brings extensive experience working with organizations to develop person-centered and community-tailored anti-racist engagements to improve the health of children, families, and communities. Dr. Selk has a Doctorate of Science in Science and Behavioral Science Society, Human Development and Health from the Harvard T.H. Chan School of Public Health, and undergraduate degrees in biology and psychology from the University of Washington. Dr. Selk has previously worked at Dana-Farber Cancer Institute and as a manager of research and clinical relations at Advanced Health Solutions. She currently serves as a member of the Cambridge Human Rights Commission, to which she was appointed to in 2013. Thank you, Dr. Selk, for being here with us. It's a pleasure and an honor to have you here.
Thank you so much. And thank you to the YWCA of Central Mass for this opportunity and for holding space for this really critical discussion, allowing for exchange of ideas in this area. I'm really grateful to be invited to be part of this discussion and truly honored to be on a panel with Dr. Castillo, who is a role model for community-based and anti-racist praxis in public health. So thank you so much. I think I have slides. I don't know if people can see them.
Craig?
I will maybe start on the second slide, which is the questions that I was given for grounding our discussion. Oh no, that's the last slide. On slide 2, the questions. I was really excited to see these questions when I was asked to reflect upon these. And I want to say thank you for the opportunity to really engage in some self-reflection. As you can imagine, this pandemic, that doesn't oftentimes happen, or we're not given that space. A year into this pandemic, thinking about what my journey to really bringing anti-racist praxis into my work was a really, I think, useful time for me. And I'm really excited to be able to share this with you and think about why thinking about racism and dismantling racism is so essential to public health practice. So as you can see here, it's both about my journey and also about why this is such a critical space for all of us to hold. Next slide. So I wanted to lean into how the work of leaning into bringing anti-racist work into public health spaces and how I started to really think about how we can unravel the binds of systemic racism that making it challenging for all of us to breathe. And one of the things that I want to recognize is that I think more than almost in any other domain, you can really feel that we are standing on the shoulders of giants in this field, that there are those who gave their all, including their lives, for this work to continue. So I've taken the approach in this presentation of really grounding what I want to lift up in quotes made from others who made my work possible. And so this is a new approach for me, but I just really wanted to make sure that I was grounding myself in that as the center of my work. And hopefully it will be engaging for you as well. Oh, it seems like there might be black boxes on the screen still. I'm seeing from the chat. I don't know if that could be moved. It looks like it might be in the bottom of the screen. Before coming to my role as the state, my role was not always explicitly an equity role, although I was always working on equity-related projects. Instead, I might have the title of PI, project director, data lead. And when I asked for explicit support and dedicated staff to hold equity spaces, I oftentimes received pushback and was told that that wasn't necessary. That it was, since I was at the table, then there wasn't really need for anyone else to hold space for equity discussions. And I can't ever know what the intention was there, whether it was because I was already a woman of color or if there was not enough respect for the space we need to hold for equity. But in my experience, being asked to both own a project and the deliverables and to own the equity space is like being asked to be both the brake pedal and the gas pedal at the same time. One role is really about getting us where we're going, and the other is oftentimes reminding us that we need to slow down and make sure that we get there in the right way and that everyone gets there together. So I realized pretty quickly on my journey that if I was going to be asked to continuously hold the equity role anyways, I'd rather that be my formal position and have that voice behind me and that power and structure behind me. So when the opportunity presented itself, I made the decision to enter as a director for the health equity work at the Mass Department of Public Health. And since you are, I think, having some trouble reading it, I wasn't planning on reading the quotes. I thought they'd be available for you, but I will just read them here. The first quote is, "The function of racism is distraction. It keeps you from doing your work. It keeps you explaining over and over again your reason for being. Somebody says you have no language, and so you spend 20 years proving that you do. None of that is necessary. There will always be one more thing." Toni Morrison, novelist, 2008. And the second is, "Politics, although not perfect, was the best available nonviolent means of changing how we lived. Politics is not an end, it is a means to an end," by Maynard Jackson, Atlanta's first Black mayor. The next slide, if we have it, maybe we don't have it, is slide 4. And really wanted to acknowledge that one of the things that drew me to DPH was that they had already begun the work of building in a racial equity movement within the department. It really started as a grassroots efforts in the bureaus and offices following the murder of Michael Brown. And that really started what became the racial equity movement in 2014. So while I'm definitely part of it and contributive to it, and I'm really excited that since I've joined, we're seeing more and more that it's being built into the not just certain areas of the department, but it's really how we do business as a department. Really wanted to acknowledge that there have been years of work and grounding that had happened before I ever joined, and really lift up and honor that space. Next slide. So building an anti-racist practice into a bureaucracy is definitely not something for the faint of heart. I've heard it said that working in the nonprofit sector or in the private sector can oftentimes be like riding a jet ski, where you're really in a position to be maneuverable and responsive to rapid changes. Making changes in a state agency can be more like trying to move a cruise ship. Things move slowly, but when they do start to move, you can really see changes that impact a high number of people. And so the power of that analogy, I think, is the opportunity to shift the ways that we do work within public health was a large part of what drew me to the department. However, being part of the system means that one must remain constantly vigilant to consider when and how you are changing the system and how the system is changing you. As Audre Lorde reminded us, the master's tools will never dismantle the master's house. So it's really up to us to figure out and what are those tools that we need if we're committed in this work to find and create new tools in the work of rebuilding a system that serves all and not just some. Next slide. So a big part of my role as I see it is to lean into uncomfortable conversations, to ask the uncomfortable questions, to be the person that just as we get our hands or feel like we're getting our hands around one complicated challenge, to be the one queuing up the next problem that needs to be addressed. If we didn't have the foundation of the racial equity movement at the department, I think it would be a lot harder to do and be effective within my role. If I wasn't able to um, take a statement made by another colleague, maybe about whether or not the reasons or intention behind why a system or a program might be asking for ID, and to really challenge that and to bring up racism and why that might be a piece of the puzzle and understanding kind of what we ask for and when, it would be a lot harder to do the job that I'm doing. But having really a grounding of and explicit discussion of and recognition of the important role that systemic racism plays and how it's really essential to doing public health work has helped me in these moments. Not only because there's a growing awareness nationally, but there's a growing skills and capacity at the state and local level for leaning into these conversations and really being able to talk about racism explicitly and call out when we start using coded terms and things that we might feel more comfortable with and being okay to sit in the discomfort so that we can acknowledge not only the historical trauma and harm that have been caused by systemic racism, but also lift up and address the current harm that is being done and continues despite our efforts and our best intentions. Next slide. So while making statements about racism is a critical piece of the work, we definitely need not only allies in the work, but also accomplices, people of color, those of us with lived experience of racism and how it constrains our life and impacts our destiny, are coming into this work with a literacy around racism that is so much more acute than so many of our colleagues. It can be hard to hold space when for some, racism is the thing you can never put down, and for others, it's a choice about how and when they wish to engage. So it's really when we all collectively recognize that we need to constantly raise up how racism is a necessary discussion point in every conversation and in every space that we can even begin to recognize the ways that racism permeates the ways we move through society at every level, from the language that we choose to use to how we're developing programs to even how we understand the problems before us. And it's when we recognize and hold space for the multiple ways that our intersectional identities create different needs and different experiences, which is really so critical and vital to make sure in every conversation that our ideas to order to address and dismantle racism in the way that we need to, and make sure that we're having all the new and different voices at the table that we need and not falling into the common mistake of having tokenism or thinking that one person of color speaks for all people of color. Next slide. I do also want to raise up that the COVID pandemic is obviously a tale of the twin pandemics of COVID-19 and racism. This is highlighted by the murder of George Floyd and the growing attention nationally to systemic racism at the same moment as we were all trying to address the biggest public health crisis of our generation. But it's also, I think, a story, if I can be a little self-critical, of how a system of dedicated public health personnel who have been a progressive voice in declaring racism a public health emergency for years before the crisis, who had early signs that the pandemic was disproportionately impacting historically marginalized communities, and a wealth, generations of information of how priority populations have had persistent health inequities across a number of health conditions across time, were not able to effectively make the case that we needed to have a preventative strategy across all levels and across all domains to address equity in the COVID response before health inequities could arise. I really believe that our system is still based on reacting to emergent threats and making the case about where resources go and why. And so it makes it really hard for proactive prevention strategies that can challenge systemic racism effectively. For me, this really highlighted that awareness isn't enough, that we really need to lean into and change our system in ways where we're addressing systems of oppression and systemic racism in our approach to every challenge at the onset, so that anti-racist framing is part of development, not an add-on when things have reached a crisis level. And finally, on my last slide, I want to lift up for everyone on this call that there's a need not only for addressing and the dismantling of systemic racism, but it's also clear that this is the work of generations, that each generation is picking up the mantle of the generation that came before to try and shift the arc of history closer to justice. But as a manager, as a friend, I also recognize that to survive this work requires that we support each other through this work, that we need to set boundaries on the work and have support networks of our friends and colleagues to help us maintain our joy in the face of a culture that promotes anti-Blackness and perpetuates harm to people of color. I wanted to highlight a couple of examples from my own personal experience just in the past few weeks. I had a friend, email me to remind me that any institution we're at can and will replace us, but we are in fact irreplaceable, and we need to treat ourselves as if we're irreplaceable and put ourselves first in that context. Another colleague sent me a reminder that in the fight for our collective liberation, we need to remember the 3 Ps. When do we need to push? When do we need to pause? And when do we need to protect our peace? We also have affinity spaces. Monday was our monthly managers, Women of Color Managers group. I really wanted to highlight and stop and pause to recognize that these relationships are so very necessary for the work so that all of us can keep doing the work. I wanted to end by sharing that when I was a child, I dreamed of being a veterinarian. I never dreamed that this would be my work. I do this work not because it fulfills some childhood wish, but because I truly believe that the work is necessary. I have 3 children of my own, and my dream for them is that they are free to choose the path of greatest joy. That is not a dream deferred. That in order to fight for a more just future for those to come doesn't become the linchpin of their dreams. So I just want to thank you for your time and attention and really, again, gratitude for inviting me into this space.
Thank you so much, Dr. Selk, for your powerful and passionate, real words. Very well received. Our next panelist and speaker is Dr. Matilde Castillo, known as Dr. Mattie, and known in our community as La Doctora de la Comunidad, our community doctor, and that's the affectionate term that we have for Dr. Castillo. Dr. Castillo has always held a professional and personal mission to work with the underserved. She was born in Camagüey, Cuba, and immigrated to the United States in 1962 as part of the Operation Peter Pan. Raised and educated in California, she completed her medical training at the University of California, San Francisco. She moved to Worcester 32 years ago and has practiced as a board-certified physician in internal medicine in the Worcester community for both Family Health Center and UMass Memorial. She is also an associate professor of internal medicine, family medicine, and psychiatry at UMass Medical School. In 2009, Dr. Castiel founded the Latin American Health Alliance, LAHA, a nonprofit organization in Worcester dedicated to combating homelessness and drug addiction. And at present, she continues to serve as its medical director. LAHA's programs consist of the Hector Reyes House, a substance abuse treatment facility for Latino, Latinx males, and 2 transitional houses. In 2015, LAHA opened Café Reyes on Shrewsbury Street, an innovative jobs training program for the residents at Hector Reyes and transitional houses. In September of 2015, Dr. Castiel was appointed as the City of Worcester's Commissioner of Health and Human Services, the first person of color, the first woman of color, the first Latina to hold the position. She oversees the divisions of public health, youth services, human rights and disabilities, veterans affairs and elders affairs and homelessness, along with advancing important news initiatives that fall under the scope of youth violence and the current opioid crisis. Most recently, she has been awarded in 2019, 2020, the UMass Medical School Chancellor's Medal for Distinguished Service, the Edward M. Kennedy Community Health Award, Family Health Center Health Community Award, and Lift Community Hero Award, and WBJ Hall of Fame. I also will give her the recognition that she is a person who makes good trouble and stands up constantly at her own risk. But she needs to know that she has an entire community behind her. It's my honor and pleasure to present Dr. Matilde Castillo, our next panelist. And a question was asked for information. This is being recorded, so you will be able to have an opportunity to view it again on YouTube when you choose to. Mattie?
Thank you, Maritza. You're going to make me cry here. So thank you so much. And Sabrina, you are my idol. So I'm thrilled to be in a panel with you also. So thank you all for being here. I'll tell you a little bit about my journey into health, which started when I was young. And as Maritza said, I'm a Cuban immigrant. I lived with my parents and my brother in Los Angeles. And I always felt at home and a part of the community when I was surrounded by other Latinos. And so felt comfortable in that environment. I didn't know the word racism at that time. It really, when I was young, I never had to experience it in the same way my parents did, like so many parents still do, with the constant struggle against poverty and systemic oppression. For me, I experienced it as I grew up, and I left my community to enter the medical field. And ultimately, when I went to med school, I was interviewed for medical school by a hematologist who was a Black man. And he was my first introduction really into the medical world. I wanted to be in medicine but never felt in a way that I was going to make it. But when I got interviews, I was pretty impressed. But when I met him, it was sort of the feeling of feeling comfortable, which I didn't feel before. I felt comfortable around him because he made me feel like I belonged. And in a lot of places that I would go to, I didn't feel like I belonged. He was somebody that I could relate to, someone who believed I actually belonged in the field. So I accepted the invitation to attend University of California, San Francisco Medical School, primarily because I wanted to be around people who accepted me and that I could see others like me were part of the university. And as I continued my career, I always found my sense of home and belonging with other Latinos and Black colleagues who were always closest to me because we could relate to one another. And as a Latina immigrant moving through college, medical field, and into my career, these are places where racism and oppression took its toll on me personally. It creates this weathering and exhausting sense of stress and trauma that sticks with you. It's always on your shoulder as you move through the world. I think my parents and I think of our Black, brown, and immigrant communities. I think back to those communities, and I know they experienced all of this, in addition to the stress and trauma and frustration they experienced while living in poverty, only having few resources, broken systems, over-policing, food deserts, cracked sidewalks, and more. And because of oppressive systems, the physical space of where BIPOC communities live continue to experience segregation and environmental racism. They are pushed into these neighborhoods through gentrification, where upward mobility is nearly impossible, with limited access to the same education and opportunities their white counterparts have the privilege of benefiting from. And yet our Black communities experience all of this in addition to the constant fear of being harmed or targeted for having Black skin. So when I came to Worcester, I knew I wanted to work for these communities for all of these reasons. I remember asking, where are the Latinos? Where do the Latinos live? And someone told me, oh, they're on the other side of the tracks. Whatever that meant, this was Main South to them. So I started to work at Family Health Center, and I stayed there for many years. It was around that time that I met Hector Reyes, and I started the Hector Reyes House, a recovery program for Latino men in recovery. I did this because I knew that recovery programs for Latino men was something that was not available, and there were not recovery programs where men felt that they belonged. And so this was one of our goals, was to make a program that was culturally sensitive to their needs. While we were in the program, I knew that they needed affordable housing. And so when they graduated the program, we were able to build 2 housing programs so that people can graduate and actually have a place to go until they stabilize themselves and get back on their feet. I knew then that job training was also an issue, and knowing that most of these men had been incarcerated for a number of years, they did not get the education and the job training that they needed. So we built Cafe Reyes, which is a job training program to integrate the men into the community, to give them a sense of purpose and for them to value who they are and ultimately provide them with jobs. So for me, working with the community to build resilience and create equitable health and public health system has become truly my career. And now as the Commissioner of Health for the city of Worcester, I have the opportunity to fight for this from the inside. I work with teams to center the needs of our homeless community and those who struggle with addiction. I want to work to provide equitable public health policy programs and initiatives to support our Black, Brown, and immigrant communities with the resources they need to have better lives. Because these social services are truly what makes an impact, I want to show this slide next, and I'm going to have problems because I'm not good at showing slides, but let me see if I can. Let's see. Hold on. Let's see. Can you see this slide? Can everybody see this?
Yes,
Yes,
we can.
Yes, we can, Mattie.
Great, thank you. I'm sorry. So I want to just at least show you the how I work in health overall, and what are some of the things that I see. Let me see if I can minimize that. Okay. So if I look at where we spend a lot of time in healthcare, unfortunately, is because we don't have all the preventative stuff that we need to keep our community safe and disease-free. So we end up a lot of times working with chronic diseases like hypertension, like diabetes, injuries, whether they're unintentional or intentional, and communicable diseases, so just like what we're experiencing now. We try to work and figure out why we have infant mortality and why our life expectancy for Latinos or Black are so much lower than for the white community. But then the reality is, this is where I spend most of my time, is looking at risk behaviors. And this is where you tell people about smoking and try to get people to stop smoking. Poor nutrition, people who don't have access to food. How do I get them to eat better food? Or people who don't have a safe place to exercise. How do we create safe place to exercise, and how do we engage them with that ability when people are working around the clock, sometimes it seems. Then the violence that exists in neighborhoods, alcohol, drugs, all of these things are what I spend most of my time working with. But I can't do any of that without looking at their living conditions. And this is truly what we have to spend most of our time in. And that's what we call the social determinants of health. So in medicine, when you think about that, I'm looking at effects of smoking or effects of poor nutrition, what we really need to look at is, how do I provide housing for people? How do I provide transportation for people? How do I provide safe water for people, employment for people, access to healthcare? All of these things are the social determinants of health that we talk about, and we've been talking about for a long time, but yet we're not providing these services. And none of this also would be possible unless we look at racism overall and look at both the social inequities, class, race, ethnicity, and the institutional inequities that exist. So really looking back on with that, if we don't change and looking at this upstream, if we don't deal with racism being the root cause of the social determinants of health, we're going to be left with my working in the area of risk behavior and chronic injury. So this is the area, social determinants of health, but then really looking at how we change racism and how racism affects the social determinants of health. So I'm going to see if I can jump back to where I was. So So I'd like to highlight also that the study of health disparities have been around since the 80s, and the social determinants of health was coined by the World Health Organization almost 20 years ago. With this in mind, we have only recently shifted our focus to the relationship health disparities has with the social determinants of health and systemic racism. As a commissioner of Health and Human Services and as a practicing physician for over 33 years, I find myself frustrated, angered by the role our healthcare and public health institutions have played in oppressing and silencing BIPOC immigrant and queer communities throughout history. The social determinants of health, which includes systems of housing, education, healthcare, financial institutions, and more, are historically intertwined with systemic racism, and they manifest themselves in health disparities, which ultimately demonstrates poor health outcomes and shorter lifespan for communities of color. So what role do we as leaders in public health and healthcare play in affecting meaningful change for our communities of color in Worcester? How do we work together across sectors to validate the historical trauma our communities of color have experienced? How do we respond with empathy and understanding so that we begin to mitigate the harm our institutions have caused? How do we change our language and practices and policies to meet our communities where they are and center their voices throughout the process? The time is now. We have to look at our history and the impact racism has had on our communities. We must change the way we do things. The culture of white supremacy and racism are the underlying diseases that we as public health professionals and advocates need to come to terms with, call them out by their names, and work together to overcome. Throughout the past year, the pandemic has exposed what many of us already know to always have been true, that our communities of color geographically live in areas of the city that are the most vulnerable. With the CDC Social Vulnerability Index, we are able to visualize these areas in Worcester, and they are the same neighborhoods with the highest COVID positivity rates, and the same areas where the city's Black, Latinx, and immigrant communities live. The Social Vulnerability Index uses 15 different social factors to determine geographic vulnerability by census tract, including factors such as poverty, income, lack of vehicle access, crowded housing, unemployment, and more. These are our social determinants of health. These are the aspects of life that are directly impacted by institutional and systemic racism. There is no argument against it. Racism is, without a doubt, a public health crisis, and it requires urgency and our full attention. I know that we're exhausted, hurting, and grieving. We are tired of seeing public servants murdering our Black and brown children. We are tired of constantly having to explain our perspective only to be met with fragility and hostility. We are tired of under-resourced schools, a criminal justice system that targets our men of color, and the ways our school build a systemic pipeline to incarceration instead of pathways to graduation, higher learning, and employment. We are tired of being tokens, used as numbers to demonstrate a feeble attempt at equity and inclusion. We are tired, and this takes a toll on our mental health, which is another part of our healthcare that has failed our Black and brown immigrant and queer communities. But we can't give up. It is up to us to continue to fight for our communities, to act in solidarity with our Black communities, and dismantle these systems that continue to oppress us. We all have a role to play in this fight. Often important and brief decisions are made in rooms with the doors closed, and these decisions have a massive impact. This needs to change. We need to be at those tables to influence decision-making processes through our lens so that our communities can begin to see changes they need in order to survive and succeed. Representation matters, and those of us who are already at the table need to advocate, make room, and hold space for our future BIPOC generations as they enter our workforce. We need to invest in our schools and youth so we can build them up and foster resiliency, support systems, and mentorship. We need to create career pathways for our youth so they can one day sit at the table and hold positions of power where they are paid for their work, lived experiences, and perspectives. We need to invest in equitable housing and wraparound services. We need a new model of care where the client's needs are at the center and they no longer need to change their lives to fit an archaic system that have failed them for generations. This is the change I believe in, and health justice and racial justice are one and the same, and we need to act accordingly before more lives are lost at the hands of racism in its various forms. So thank you.
Thank you so much, Dr. Castillo. Thank you. Bravo to our two panelists, Dr. Selk and Dr. Castillo, for being the warriors and advocates that they are, and pushing and declaring and being heard that racism, yes, it is a public health crisis. So thank you so much to both of you. We have a couple of questions. Someone had asked if there a contact information for both of you that you would like to give out, and if folks would like to reach out to you. So if you'd like that, you can put it in the chat, and that way folks can reach out to both of you. Any questions other questions that we have from the audience? One of them is, what are your thoughts on the recent suggested ban on menthol cigarettes?
So am I on mute? So I think absolutely. Interestingly enough, menthol cigarettes are the ones that communities of color use. I'm still trying to enter that. I think it went through. And so the fact that we banned everything else but menthol says a lot. So I am thrilled that has gone through the process also.
I agree with Dr. Castillo. I think the fact that we put that off to the side and weren't explicit about what does that mean and what is the history of menthol cigarettes and the advertising for those and where they are being sold and where they're advertised, I think is one of those examples where we try to be race neutral, and we really need to be race explicit and recognize the history and targeting and tailoring of advertisement and products to communities of color.
Okay, thank you. And I want to say that I remember as a kid always watching all the very cool advertisement, having these very sleek, black and brown people smoking cool cigarettes, which were the menthol cigarettes. It's unfortunate, again, targeted for our communities. So any other questions? Okay. Well, if we don't have any more questions, any last words that either you, Dr. Selk, or Dr. Castillo would like to say before we step off? Here we have from Judy Perry, Ms. Castillo. First, I apologize for my statement during the school committee meeting regarding the committee having no people of color, but I want to ask, what is your view of this health and sex education?
So I think it's something that we've been looking to implement for a number of years. I think one of my biggest concerns is making sure that youth know how to handle relationships that were LGBTQ inclusive. I think the more information, the better our youth will do. I think people have the impression that, if we give people a condom, that it means that we're telling people to go out and have sex. And the reality is we're showing people how to protect themselves. And that's one of the, I think, the most important things. So I'm certainly for, both books that were presented. I think that I went through the 3 R's that were put forward, and it wasn't evidence-based, but research-based. It was K through 12, because some of those discussions, and people think that we're going to start talking about sex when you're in kindergarten, which is not the case. I go back and I think about even for myself, who was actually, grew up with parents. We always think that our parents are going to tell us what to do. But the reality is I had a similar experience because I didn't know how to act and how to handle when somebody was actually touching me in certain ways that I didn't think was appropriate. So again, that makes me, so I think the best of us and the best parents' intentions are there, but I think a lot of it isn't being discussed. So being able to discuss that will protect a lot of what's happening in our community.
Thank you, Dr.
and it's not specific, I think, to Worcester, but just recognizing that as a state that, it surprises me. I'm not originally from Massachusetts. I will say I have deep family roots, but I grew up in the state of Washington. And so I experienced abstinence only education. And I remember being in middle school and just being floored that we were just starting conversations and I'd already had to navigate with my own friends discussions around topic areas that I was completely ill-equipped to handle, and we weren't allowed to even ask the questions or to ask for help, as Dr. Castillo was alluding to. And I think if our adults aren't prepared to engage with our youth about healthy boundaries and consent and what does that look like, what is a healthy relationship, then we're doing them a disservice. I know my own child had to, have help develop a curriculum at her school around how to be inclusive of queer children in a sex education and health education. Like, what does that look like as part of her GSA work? And so, I think that putting the burden on children to educate themselves, we're truly doing them a disservice. And I did see the email about the request for research or internship opportunities, and we do have a student experience program at the department, as well as opportunities we hold a number of data resources at the Department of Public Health. And if you reach out to me, I'm happy to put you in contact on those issues.
Thank you so much. Sabrina, this is a question for you. So you talked about tokenism briefly. Could you please talk about it more, and how should organizations avoid tokenizing employees?
I think when I think back to my experiences, I can't tell you how excited I have been to be in spaces where we're talking about the needs of maybe women of color, let's say pregnant and postpartum people who are Black, and infant mortality, poor health outcomes in that space. And I look around the table, and most of the people there are pregnant and postpartum women who, who've experienced pregnancy, who are Black. And we were really talking about the issues in our community, as opposed to being in a spaces where I'm talking about those outcomes and I'm maybe the only person of color. And it makes a huge difference about what gets raised, the number of experiences that are reflective, the knowledge that we can bring to the table, if it's something abstract versus something lived. I think that if we don't have if everyone looks like you at the table, then we're doing something wrong, right? Like there should be diversity. There should be diversity in voices and opinions. And I think anytime someone is asked to speak for an entire community, we failed at the onset. I also have seen it is really hard to do this work when you're the lone voice being asked to speak for your entire community, often being told and called in to talk in ways that might be uncomfortable and maybe you don't think the others are ready to hear. And I have joined spaces just to be another voice because someone has told me I can't stay at this table if I'm the only voice here. Like it's too hard to carry the water by ourselves. And I think it behooves all of us to take a critical look at our tables and diversify if we don't have that there, to be explicit about it, to say that that's what we need to have strong policies and make good decisions. If we don't, we're going to get to the point where we're at implementation and we realize we've come up with a plan that won't work for anyone. And it's inefficient, it harms folks, and it's really unacceptable at this point.
Would you like to add to that, Dr. Castillo?
I think she covered it very well.
Thank you. Yeah, and I just want to agree with you, Dr. Selk. I think one of the biggest mistakes that often is done is that people will ask a person of color simply because they happen to be a person of color to be part of a board, even though they may not have, the interest or the expertise in what that organization or that board is, their mission is. And it's really unfair to also make the assumption that because you are a person of color, that you do have an expertise on, of racism, and you'll be able to guide folks. So that's really important to be very, very aware, and not make assumptions, because I think that's tokenizing happens quite a bit, and you actually set up people for failure and stress when they do join these boards because they feel pressure to. So another question that we have here is, Dr. Castillo, what should the city's role be to counter substandard housing neighborhoods that contribute to health issues?
I think that's part of what we're trying to do. There is work being done. Just we have a homeless task force that the city manager runs with all of us, and looking at all the players together to work to provide housing. We have housing in the works right now, but it shouldn't just be city who's doing it. There certainly has been lots of data on anchoring institutions, which have been implemented in different areas of our country, where cities and their large nonprofits, they use their endowments and any funding to invest locally, so invest in housing. UMass is beginning to do some of that. And we need our community to understand that, and that we're not going to succeed unless we start doing that same process of anchoring institutions, that we buy housing, that we provide jobs for people, that we support our mom and pop stores, that we do that to support our neighborhoods. And that's a process where every institution in Worcester should be a part of, and we should make that a priority. That's saying that we are, again, we're the second largest, the second healthiest city. We've always been the first healthiest, not city, the first healthiest state in the country. And yet you look at our neighborhoods, and depending on what zip code you live, life expectancy is completely different. You can look at our west side of our neighborhood and compare that to the main south neighborhoods, and there's an 11-year difference in life expectancy. So all of that has to do with housing, with jobs, with transportation, our school systems, where our school systems should truly not be based on taxes. It should be across the board, that everybody does it the same. However we do that we provide funding to all the schools. But that's just, I went ahead of housing, but anyway.
Yeah. Well, thank you so much. We are out of time at this point. There are some great questions. Unfortunately, we're not going to be able to ask them, but I want to thank our panelists for being here, and not only being here, but for the work that you are both doing on behalf of our communities. It's hard work, it's stressful work, and sometimes it may have actually shortened our lifespan when we're out there doing this work and combating racism, which is, it's killing us. It's what it's doing. So the takeaway for folks here is that, to acknowledge the fact that racism is real and that it is a public health crisis, because when it shortens lifespans, in all these ways that have been discussed here today, it's something to be heard of and acknowledged. And people always ask, why does race matter? And I have a thing here that I always say, that race still matters because despite persistent social, political, and environmental inequities, there are those who question the relevance of focusing on issues of race and racism. Our history, as well as current data, will not let us forget that race still matters. Race still matters because racism is only one component of the complex system of oppression that includes all the intersectionalities of sexism, classism, ableism, ageism, and heterosexism, and each one supports and reinforces the other. Race still matters because the rules and standards of our society are not race neutral. So thank you everyone for being here with us. I appreciate, and please, I hope you take to heart what you have learned here today, what you have heard, and that you will, in your own spaces, do something to advocate so that we as people of color do have better quality of life, that we are able to eventually eradicate and dismantle racism, because it's going to take all of us. Thank you so much. Be well. Okay.